ਕੈਨੇਡਾ ਦੇ ਸਿਹਤ ਮੰਤਰੀ ਜੀਨ-ਯਵੇਸ ਡਕਲਸ ਨੇ ਇੱਕ ਨਿਊਜ਼ ਕਾਨਫਰੰਸ ਦੌਰਾਨ ਦੇਸ਼ ਅੰਦਰ ਚੱਲ ਰਹੀ ਕੋਵਿਡ-19 ਮਹਾਮਾਰੀ ਸੰਬੰਧੀ ਫੈਡਰਲ ਸਰਕਾਰ ਦੇ ਜਵਾਬ ਬਾਰੇ ਇੱਕ ਅਪਡੇਟ ਪ੍ਰਦਾਨ ਕੀਤੀ। उन्होंने कहा कि सरकार सरहदी पाबंदियों की समीक्षा कर रही है तो संभावित तौर पर आने वाले हफ्ते के अंदर तब्दीलियों का ऐलान किया जाएगा।
For 2 years now, our government's actions in the fight against COVID-19 have been based on science and prudence. As we all know, science is continuously evolving, and as we have done since the beginning of the pandemic, we will continue to base our decisions on the best available scientific information and on prudence. Now, let's be clear. The public health restrictions currently in place by provinces and territories in particular were always meant to be temporary. Some of these restrictions will be with us for a long time. Others will be lifted as soon as the epidemiological situation, science and prudence allow it. That said, it's important to keep in mind that these measures are intended to limit the harm caused by the virus. All measures are subject to constant re-evaluation, and we will continue to adjust them according to science and prudence and the evolution of the epidemiological situation. With the worst of Omicron now behind us, our government is actively reviewing the measures in place at our borders, and we should be able to communicate changes on this next week with the support and the advice of the team of Dr. Tam. We would all like to know for sure what the next few weeks and months have in store for us, but after 2 years of this pandemic, we know that this virus will always find a way to surprise us. We know that the question is not whether there will be other waves or variants, but rather when. Over the last few days, we have all heard the phrase, "We have to live with the virus." We all agree that we have to learn to live with the virus, but concretely, what does it mean to live with the virus? I would say that living with the virus means that people have to stop dying because of it in such large numbers. Secondly, living with the virus means that the virus in our healthcare system must be able to coexist without the latter being paralyzed. Without cancer patients being told that their surgeries will have to wait because our hospitals and our healthcare workers are overwhelmed by COVID-19. Thirdly, living with the virus means that we must individually and collectively optimize the entire use of our tools in our toolbox at our disposal to limit transmission and the severity of infections.